Hey everybody, we are live here with Dr. Jeremy Sutton. He is a physical therapist at Vivian Physical Therapy.
Yep.
That's what it's called, yep. And like I've been telling you guys for the past several days, he's going to share some amazing information with us, and hoping that a few of you can join us live and ask some questions at the end. And even if you have questions in the middle, I'll be keeping up with it. So be sure to put your questions out as he goes, and when he gets to a place where he can answer, we will make sure and get those questions answered for you. So we're going to go ahead and get started, and I'm just going to hand it on over to Jeremy.
Wow. Thank you, Lisa, for having me. I'm so excited to speak to your group. And, hey, somebody actually is watching, so that's really cool.
Whoop. Hey, Angel Bell.
So thanks for watching. So, hey, Lisa and she came on my podcast. I created and I host the Servant PT podcast. We're talking all about servant leadership. My heart is really to serve everybody, but Lisa and I kind of meet the same group. I really try to serve women 50 and older. And that's just over my 9 years as a PT, I've learned that that's really the group that I get along with more and I relate to better for whatever reason. So that's who I really have started focusing on serving. And so with that in mind, I asked Lisa to come on my podcast, and she did. And then we just kind of started talking, and one thing led to another, and here we are with this group. And so I'm in the process of creating some videos and some online courses for low back pain, neck pain. I also want to do one about servant leadership next year, but I'm going to talk to y'all a little bit today about neck pain, how you can kind of stay away from it, how you can prevent it. And I'm going to give y'all at the end of this a link to a free course with 6 modules in it that help you stretch and strengthen your neck and take care of headaches and those horrible cricks in your neck that you get sometimes when you wake up. And we're just going to talk a little bit about that today and go through it. And if you have any questions, please ask in the live video. And if you have questions, you can always email, text, or call me, and I'll give you all that too. So the first thing that I added in the link that you're going to get to my website is a PDF on 6 sweet ways to say goodbye to neck pain. So that was the worst title I could think of, so that's what I put it. And so that's what it is. And so we're just going to go through what that ebook is for just a second, and I'm just going to hit on each one of those, and then we'll talk about what's in the course and how you can use it to better improve your life. So the first thing is how to improve neck pain is in the PDF is to set up your home appropriately, okay? So right now I'm sitting here, I'm kind of looking up into the camera. That's great for live videos, but it's not great for sitting at home working on your laptop or looking at your TV or whatever you're doing. So you kind of want to make sure that you're in line with whatever you're doing at home, whether it's watching TV, reading a book. You don't want to be looking up or down too much. It puts too much stress on your neck, and I talk about that a little bit more in the book. The second thing is you want to have a pretty good stretching routine. I don't like stretching. It's kind of boring, but it is necessary. We want our joints to move. We want our muscles to be lax enough to do the things that we need to throughout the day. So just go ahead and start just 2 or 3 stretches really, and that's it. And I actually put that you need to stretch in the book, and then later in the modules I show you the stretches to do. So that's the second one. And then we're going to talk about stabilizing your neck and then sleeping. So to stabilize, another word for that we would just say is strengthening your neck. So I give you a few exercises to try with that. Sleeping posture. In the course you'll see how to sleep with a towel roll and extra pillows to kind of put your spine in a more neutral or a more straight position to take the pressure off of it. And so that's really been an important thing with some of my patients. I always hear the worst thing is when you can't sleep at night, because if you can't get the rest that you need, then you can't serve others. You can't go do whatever it is you want to do that day. It's just miserable. So we really want to talk about how to sleep and how to do that better. And then keeping with the S's, I put sipping your way to a healthier neck. And we want to drink plenty of water. Our bodies are 70% water at least. And if we're not hydrating like we need to, we're not going to feel as good as we do. I'm addicted to coffee in every shape, way, and form, and I hate to say that on the video with you, Lisa, but I love coffee, and so I'm trying to do better. But when I drink my half my body weight in ounces in water every day, I feel like a different person. And yesterday I didn't, and we drank some water last night before bed or whatever, and I felt a little bit better. But it's just we need to hydrate, and we need to keep our body moving like it needs to with water. And then the last thing is any little ebook I do, I always try to put in, you may want to seek out a physical therapist, because that's what I am. That's my shameless plug for that one thing that I do. And most physical therapists, most medical professionals in general will give you, well, I take that back, I'm not saying most, a lot will give you a free call, 15 minutes, or give you something. And that's what I try to do. So if anybody looks through that ebook or even this course and you say, I don't know if this is for me, but I've had a really bad case, or I had a past surgery, I'm going to give you my cell phone number. By all means, text me, send me a Facebook message. You can find me to ask me questions, and I'll be glad to answer those. So that's just kind of an introduction into the ebook, and then we'll talk about the course. So this is the first course that I've created for online. It's something I've been wanting to do, and I actually was really focused on a low back pain course, and then we talked about doing this, and so I created this course this week. And so this was a really good motivator to get some things done, because it was just amazing what we got done. But the first module is sleeping position. And so it's the same as in the ebook. The sleeping position that I talk about is using towels and pillows to position yourself in a more comfortable posture when you sleep at night. Anything that I'm showing you on these modules, you can do everything I show you for about $5 or $10. I think the most expensive thing is going to be a TheraBand, and you can order those online really cheap, and you don't absolutely have to have it. So you can use just a regular bath towel, and I go through this in the video. Just roll it up and slip it in your pillowcase. You can lay on your back, you can lay on your side, and it still supports your neck and keeps it more in line with the rest of your spine. And if you're waking up with neck pain all the time, this may be something that you need to do to help. And I will tell you that it doesn't help everybody, and some people say, no, that didn't work for me, and that's okay, but it helps a lot of people. And then the second thing is using pillows to put a pillow between your knees when you sleep, put one under your arm, and it just makes your body more stable and more flat and more in line with your spine. It takes the pressure off your spine while you sleep, and so hopefully when you wake up in the morning, you'll feel more refreshed and be ready to do the things that you need to. So the second thing that I show in the modules is stretches to do. So most of us carry our tension in our shoulders. I certainly do. Most of us have those little knots in our shoulders that don't feel good. And if you don't have time to do other things, you can absolutely stretch. It requires no equipment, no special place in your home. You can just stretch. And I go through an upper trapezius stretch here, an elevator scapula stretch, which is the next muscle over, and then a couple of, I believe a corner stretch, and then a couple of other things. So there's just 3 or 4 stretches in there in the video for you. Use them, try them out. They're real easy to do, no problem with that. The next thing I talk about is stability, and it's just strengthening. So I go through basically shoulder shrugs, shoulder blade squeezes, and then 2 or 3 other, I believe, chin tucks, and then a couple of other exercises that you can use, a TheraBand or a cord, any kind of a stretching band that you may have. You could even use weights for that. So those are all really simple exercises that you can do, and it strengthens your neck and between your shoulder blades. One of the most important exercises that I do a lot of times is just a sitting up straight and squeezing your shoulder blades together. Because everything we do is in front of us. Right. If we worked behind our backs all the time, our chest would hurt all the time, but we don't, so we're always like this. Especially us guys, my head's always forward, and it just looks silly, but that's what we do. And so that's why we all have neck and back pain. And so just these simple stretches, these simple exercises can really strengthen and stabilize those areas in your body and help you get rid of all that pain. The next thing I do is a self-massage, and I brought my self-massager with me. It doesn't look great because I didn't have enough tape, but it's 2 tennis balls and athletic tape. And so you can get this. It looks like a peanut, and I was going to patent this, but somebody beat me to it about 20 years ago. And so that was the happiest day of my career and the saddest day of my career about 7 years ago. So anyway, in the video, I go through how to take those tennis balls and put the tape around them and make them into a self-massaging tool. And I was in Academy last week, and I think they sell for $15 or $20, and which is not that much, but I don't always have an extra $15 or $20. And so you can go to any dollar store in any town that you're in and buy 2 or 3 tennis balls for about $2 and 2 rolls of cheap athletic tape for $1.50. And for $4, you have a massager that'll last you forever. I use this in the clinic all the time. I've got a bag full of tennis balls in my closet
Can I see it real quick?
Yeah.
Where is
it?
it?
Right here.
And so, can I interject real quick?
Yeah, absolutely.
So are you going to go through how and what you would do?
In the video, I did. Absolutely.
Can you give us a little teaser right here?
Yeah, absolutely. So, a little ad-libbing. Yeah, absolutely. So, we'll just do, so what I do with this is, I will put this on the spot on my upper traps, okay? I'll put it behind my neck. If you just wanted to do, let's just say a forearm massage, because I'm right here, you can just take it and roll up and down like that, okay? That feels really good on the meaty part of the forearm, okay? You can do that if you had some pain in your shoulders up in the front. You can also take that and just press it down on those trigger points or those knots that people have in their back. I'll just put this on the floor and lay on it for 5 or 10 minutes. And that's what I talk about in the video. Also put it up against the wall and just lean back on it.
Yeah, that's
you can lean on it, and then I'll turn these sideways or up and down, and then I'll just roll up and down like a foam roller.
Okay.
It does the same thing, except it's cheaper, and you can put it in your pocket if you want to and go wherever. So, tennis balls.
I love it.
That's awesome.
That's so practical.
It is.
Gina says it's got to be cute pink zebra tape, right?
Yes,
I
yes,
know,
yes.
I know, Gina. So true.
Oh,
you
Gina.
need to make one and show us pictures.
Yes.
I love it.
So typically, what I do, I'm glad you said that. There's several different tapes in my taping repertoire. There's athletic tape, there's kinesio tape, there's something called Leuco tape that'll tear your skin off if you don't put something under it. And so I usually put Leuco tape over it, and it's a kind of a shiny brown color. But you can go buy pretty pink kinesio tape or whatever you want. And when I give this to people that, sometimes when folks just come in the clinic, we just try to do it and give it to them and say, here, use it. But when I really want it to look pretty, I usually use black tape, and it looks a lot better. So, I had 1/2 roll of athletic tape in the clinic, and I was trying to do the video. So,
perfect. That's great.
Anyway, it always looks better. So I'm sorry. I'll get zebra tape next time. Gosh. So, because I don't know, I don't always want to do a massage on anybody after I leave work. Pretty much I never want to do a massage on anybody after I leave work. And so these tennis balls are amazing for you married people.
Right.
So anyway, my wife's over here. She's going to kill me. So, hey, headaches. Who doesn't have a headache every now and then? And so in the video I talk about there's several things that can cause it. Relatives, cervical pain. That's just who I am. I'm sorry. That's in the video too, by the way. That
doesn't happen to any of us.
Doesn't happen to me ever. Just right before I walked in here. So anyway, you can have cervical headaches. So cervical headaches are headaches that start in the neck, in the cervical spine, and they run up the back of your head. They're not these headaches here. They're not these. They're in the back. And I go into this a little bit more in the video, but if you put your fingers and you push on your muscles in your neck and your headache comes on, you're having a cervical headache, okay? And so how are we going to fix that? We're going to go in our kitchen and we're going to find our Pioneer Woman dish towels, okay? That's what this is. We're just going to take it, fold it up, and then roll it up like this. And then you're going to put it at the base of your head, that last bone right before it gets to your neck, and you're going to lay on your back and you're going to do some chin tucks, and that's just like this. And that's why I have a beard, because when I do chin tucks, I don't want you to see all of my chin. So it's really easy, and it doesn't cost anything. I work in an area and I've always worked in rural areas, and so I've always been conscious of how can we do this for the least amount of money possible. And I grew up like that. And so I know that money, even if you have it, you don't want to spend it on stuff you don't need. And so when you have towels in your house, and you can get tennis balls cheap. So just go do those things, and you're not out trying to buy the Gazelle or whatever the greatest thing is that you can use. And with the towel, just try it. Do some chin tucks. I go into it in detail in the video, and I show you how to do it. Just think if your headache's at a 10 out of 10, and you do 5 or 10 of these chin tucks, and you get it down to an 8. You may want to roll the towel up a little bit thicker and then do a few more. And so the point is to try to drop that 10 out of 10 headache down to a 4 or a 5, where you can go on and do the things you need to do. Because I don't know about you, but most of the time when I have a headache, it's when I have to do 50 other things, because I'm on number 40 of those. So try that. This is something a PT showed me several years ago, and it's been one of the most valuable things that I've learned. And then the last thing, and probably the best thing in here, is how to fix a crick in your neck, okay? I had a patient last week come in, called me. I've seen her, home health, different places. Jeremy, I can't look up. I said, come up here. And within 5 minutes, I had her looking up because it's usually just something really simple. Yesterday, it was really cool. One of my sweet patients has been coming for a while. She says, my daughter in Texas said she woke up and she has a crick in her neck and she's gone to this and nothing's helped. And I said, well, call her and I'll talk to her. And so I did, and I told her, and she's like, oh my gosh, I'm gonna try this. And I'll hopefully tell you Monday if it worked, because I'll talk to her. But it's real simple. That crick in your neck a lot of times can be caused by a muscle called the multifidus, which runs up your spine, and it attaches to each vertebrae. And then there's also a capsule around the vertebrae that's kind of like a Ziploc bag, and that multifidus attaches to that capsule. And sometimes we sleep wrong, Lisa, and we wake up like this, and it's because that multifidus has pulled that capsule down in between the bones, okay? And it's not a lot, it's just minute, but it pinches and you can't move. And so, what you got going?
Thanks so much for this.
Yes, you're welcome.
Yeah,
so awesome.
Good stuff.
So awesome. So, you just do, basically you can just, whatever side's painful, you're not going to be able to look up or turn right or bend right, or it'll be the other side. So it's usually one side is way worse than the other. Mm-hmm. And so if all your pain's over here, you're going to treat it over here. And you're just going to put your hand behind your head and just gently push back for about 5 seconds. You're going to do that 3 or 5 times. And then you're going to put your hand over here and push 5 seconds, 3 to 5 times. And then you just recheck your motion. Can I turn further to the right? Can I bend to the right? And the answer is either going to be yes or no. And if it's yes, great, do it again. If it's no, do it again. We may need to do it 2 or 3 sets. And then sometimes, clinically, what I do is if it didn't get better pushing away from the pain, then I'll push into the pain a little bit. And you're just real gentle with this. You do not want to force that whatsoever. But it absolutely can make a big difference. And then you drink your water. Then you take your ibuprofen or whatever you're taking for an inflammation. Or, then, if it doesn't resolve, you can go to the doctor, of course. But
5-10 seconds per
5-10 seconds for each one. So you're just going to hold, to 5, relax, do that 3 times, and then do the back 3 times 5 seconds. And then if it makes it better, you may want to do it again. I mean, if it makes it completely better, obviously you're not going to do it. But you can try it on the other side if that didn't fix it the first time. Because clinically, that's what I do. We try one side. If that didn't work, we try the other side on this particular thing.
So what is that actually doing? Is it taking the multifidus and just relaxing it, putting it back into its proper place?
It's what we call a muscle energy technique. Okay? It's something that you take the action of the muscle and you use that muscle to fix whatever the problem. So let me be very clear. And I don't want to get too far into this. I don't believe that muscles rotate and we put them back. I don't believe all that. I think there's enough research that says that. But that's not what I'm talking about. This isn't a muscle that's a joint that's turned and I feel it turning and I do a manipulation on you and it turns back. This is just where that muscle has gotten tight or has been in that position all night and it's just pulled you down in there. Okay. And then we just use that muscle. So now what does that muscle do? It pulls on bones. Okay, so now we're just using that muscle to pull back on the bone and kind of release what it's caused.
Got it. And Kayla asked, should you ice it? Which is a great question because we all feel like it's inflammation, and for inflammation we ice. So is that something you would do?
I would do ice on it for the first day, and then you can put heat on it after that. Technically 48 to 72 hours for ice, and then get the heat. But listen. There is a lot of research now that says we don't even know if ice and heat does what we thought it did. We thought ice constricted all the blood vessels and that's why it helped with swelling. We thought heat brought blood to it. But now there's some new research that says, maybe it doesn't do all that. But listen, what I typically tell people is if you do have a lot of swelling, do ice. But whatever feels better for you after that, just ice it or heat it. No big deal. Moist heat's best.
Moist heat, okay. So Stephanie, so you would recommend moist heat over ice?
I would do ice first on that for the first day.
Okay.
And then if you're noticing a ton of swelling, absolutely use ice.
Okay.
But if most of the time people come to me, they're not having a lot of swelling with this.
Right.
It just hurts.
Because we're talking specifically about cricks in the neck.
That's
we're not talking about a neck injury or whiplash
or this is not an injury. The thing is though with this, Lisa, is if you don't fix it, it can last for months.
Sure.
I've gone. My wife's aunt called one time, and I treat family. I don't like to because family doesn't listen to you, but I do treat them. And so she's like, I've been here. Nothing has helped, and I think it was within 10 minutes she was feeling better. And she called me the next day and she's like, I want to give you some money. And I was like, no, your family. But it's one of those things where if you don't fix it how it needs to be fixed, it can just last for a long time. And it is miserable because I've had it.
For sure. Okay, Stephanie, is it okay if we take a question real
Yes.
quick? All right, Stephanie says, I have degenerative discs on the right side of my neck that give me a lot of pain. Will your exercises help this? So you're talking about the course. I'm assuming she's talking about the course.
Sure.
With some things in there.
Yeah, absolutely, Stephanie. Thanks so much for asking that question. Yeah, absolutely. So one thing I would ask, and you don't have to type this on here, but is if you have degenerative disc disease, is there some nerve pain? So is there pain shooting down your arm? Is there pain shooting down both arms? Is it going into your shoulder blade? So that would be the first question I would ask. And this you may be a perfect person to call me on my phone later and say, hey, let's just talk for 15 minutes or so about what's going on. But if you just have degenerative disc, degenerative is another word for aging, okay? We're all aging, every one of us. We all have degenerative problems. So as we get older, Stephanie, I'm not going to ask how old you are, obviously, because you don't do that. But as we get older in our 60s, and so the discs in our body are full of water until we get to our 60s, most of us, and they start to shrink. So we all have degenerative disc in that sense. But yeah, these will not hurt you unless, now, like I said, if you have nerve pain running down your arm or something like that, you definitely want to be careful. What I would suggest is if you do have the nerve pain on one side, to do the stretches that are in the video, just stretch this side. So it's two of them you're pulling like this. I would just do that with my left arm and let it, and basically what that's going to do is open up the vertebrae on this side. Okay, let's just talk about this for a second. When you turn your head to the right, in the cervical spine and the neck, there's 7 vertebrae, the first 7 bones in your body. When you turn to the right, that pinches down on the right side. The nerves come out where it pinches, okay? So if you have pain on the right and you're turning to the right, the vertebrae pinch down on themselves and it's going to pinch that nerve a little bit more, okay? In me, it doesn't bother me because I don't have any nerve problems. But if you have a pinched nerve or a disc bulging on that spot, then it's going to make it worse. So, and if you bend to the right, it pinches down. And if you look up, it pinches down on the right. But if you look to the left or you bend to the left, it opens that right side up. And so if you know you have a pinched nerve on the right or a disc bulge on the right, you're going to try to start doing some left rotation, some left side bending, and looking down, because all of that opens up the right side. All a pinched nerve is something causing pressure on the nerve, whether it's a bone, the disc, muscles, in some cases benign tumors, whatever. But it's just pressure. So we just we try to relieve that pressure. That's why a lot of times it feels so good to do traction and pull somebody's head a little bit, because it relieves that pressure in a minute sense. But yeah, shouldn't be any trouble. One thing for sure is, if any exercises ever cause any kind of sharp pain or any kind of arm pain, burning, tingling, stabbing, anything like that, numbness, absolutely stop, no matter who's telling you what you're doing or what they're telling you, because that is all inappropriate responses to exercise. Burning can mean a few different things. In my quads are burning because I'm doing squats. But when you have that like fire pain, it's a different burning, and you'll know it when you feel it. But absolutely, if any of this stuff bothers you, don't do it. And either reach out to me, Lisa, or definitely your primary care provider for sure.
Very good. Do y'all have any questions? I know I want to make sure I don't miss any. We've got a little crowd behind us. Robin and Christy are back here, and Monica, Jeremy's wife, is back here as well. So if there's any questions that I missed, let me know so I'm not scrolling on here. But if you guys have any questions, please post them now, because like I mentioned the other day, Jeremy is not on this page. This is our women's only page. So this is your opportunity to ask him questions live. And again, he also is offering to, if you need to visit on the phone for a few minutes, he's put that out there as well. But this is a great opportunity if you do have anything.
Sure.
It's
and then
really good information.
Yeah, I think so. And, one thing is we have to learn as healthcare professionals, fitness professionals, is we know a lot of things that the normal person doesn't, because they don't do what we do. And just like I don't understand computer programming things because I'm not a computer programmer. So a lot of times we take for granted that nobody wants to know the information that we know,
right,
when in fact a lot of it is very helpful.
Absolutely. Do you push into the pain? Oh, Gina, can you show up I need reading glasses. Can you show up the stretch for the, can you show us the stretch for the neck again?
Yeah,
okay.
all that is in the course. And what I'm going to do is I'm going to give Lisa the link to the course. Everybody in here is going to get it for free. I'm probably going to sell it in the next 5 months for $200 to $300 a piece. So I just want y'all to know y'all are getting a good value. And y'all are going to be the first people to do this course. And so if you don't like something or wish it would have been different or something more, absolutely reach out to Lisa, reach out to me. When you get to my course, you're going to see the link to my Facebook page. And my name's Jeremy Sutton. I'm on Facebook, I'm on Instagram, I'm on Twitter. I don't like it, but I'm there. And so you can get in. If you can't get in contact with me, you're not trying at all, because I'm everywhere. So please ask me questions. I would love to serve you in that way and let you know. The stretches, what I was doing, the first one was just an upper trapezius stretch, and you're just doing like this. And you feel it stretching here, and you're just holding. Stretches are gentle. Stretches aren't meant to pull your muscles apart or tear your body up. They're meant to feel a gentle, relaxing stretch. Mm-hmm. And then the levator is just looking down underneath your arm, and your head, instead of on the side of your head, is in the back, and you're just pulling again. And now you feel it more back here, okay? And then the next one I believe is, I think I did a latissimus dorsi stretch, and there may be a corner stretch on there as well. I can't remember exactly on that one. But yeah, I'll be glad to go through that with y'all again, for sure. But yeah.
Awesome. Any last minute questions, go ahead and post them, because we're going to be signing off in just a minute. But this was some super valuable information. I love tips and practical advice that there are some things that, boom, right now I can start doing. We all have access to this course, or you will here shortly. Neck and shoulder pain issues have really been a pain in my butt. But awful. Can't wait. Yeah, I know. This is just an absolute great value. And just those practical tips and tricks, some of the things he gave us right now are excellent. And once you guys check out this course, you're going to be able to have a lot more in your tool belt.
Awesome. Sarah, I really hope it helps you from the bottom of my heart. And I think this could be beneficial to a lot of people. And, you know, I research this stuff all the time. And I shared with you a group that I follow that really opened my mind to some of this stuff. And I was actually taking pictures of another group last night at 12 o'clock or 1 o'clock. I don't even remember when it was. Monica was asleep, and I was just taking pictures on my phone of people asking questions like, hey, I have leg pain. What can I do? Do you have a course to help me? You know, can you give me some exercises? And it was a post that had been shared 10,000 times and commented on 900 times. This is a big problem. Yeah. People don't know where to turn. They don't have easy access. You know, I work at a clinic some days where there's 700 people on a waiting list. You know, people need help, and it's our responsibility as people that know how to help them to put this out there. So Lisa will put the link in the comments after we do the video. It's password protective. The password is really hard. It's NECK, N-E-C-K, lowercase. My cell phone number is 318-278-0330. I would love to talk to anybody. The rest of this day I'm spending with my wife, so if you text me, I will text you back tomorrow night. But I would love to talk to anybody about it. And, you know, I hope that this helps somebody in this group. If it just helps one of y'all, it'll be amazing. And absolutely have access to me. You know, go to my Facebook page. There's a ton of videos on there about different things. So, yeah, I just want to help y'all, and thank you so much for letting me do it.
Thank you so much. This is huge. And just so y'all know, I will go ahead. I'll post the link under this. I will post his phone number in the comments as well. But this video will also eventually, sooner than later, make it to the members area of the website too, because we know with Facebook it's just going to get pushed down. And if you want to go back and look at it again, it's going to be difficult. So the video will be up on there as well. Let me see. My chiropractor does a lot of these things, and he's been helpful, but this will be so valuable. Why have I not? And it cut off. So anyway, okay. Well, with that, we're going to go ahead and sign off. Thank you guys so much for being here. I really, really am thankful that you joined us. And Jeremy, thank you so much again for such an amazingly valuable course to give to our members. We're so pumped and so thankful to have your time today. Appreciate you.
Thank you so much.
Okay, guys, we're signing off, and we will talk to you later.
Bye.
Have a great rest of your Saturday.